Good morning. Welcome to my YouTube channel. This is Mr. Dibo, and this morning I want us to answer the question on rheumatoid arthritis. So subscribe for more YouTube videos and insights. So let's look at this question. So I want us to answer this question where Mr. Chinyanta is a 75 years old man from Chembe compound is admitted in surgical ward with a diagnosis of rheumatoid arthritis on the left knee joint and bulks extension has been applied on his leg. So part 1, they are asking us to define rheumatoid arthritis. Part B, they are asking us to draw a well-labeled diagram of synovial joint. Then B2, to mention 3 drugs, their dose, and 3 specific side effects that may be used in treatment of Mr. Chinyanta. Then C, to identify 5 problems that Mr. Chinyanta will present with while on traction and manage them accordingly using the nursing care plan. Then D, to explain 5 specific topics that you would include in your IEC. So let's get started, and let's start with part A. Part A, they are telling us to define rheumatoid arthritis 5%. So what is rheumatoid arthritis? Rheumatoid arthritis is a chronic or subacute non-suppurative inflammatory disease of the joint, which is characterized by hyperplasia of synovial cells, excess fluid, and development of paras of the synovium. Or if this definition is so complicated, you can simply say rheumatoid arthritis is an autoimmune disease characterized by chronic inflammation of synovial membrane of the joint. So take note, in rheumatoid arthritis, it is autoimmune and characterized by chronic inflammation of the synovial membrane of the joint. B1, they're asking us to draw a well-labeled diagram of the synovial joint. So on this diagram, this is a diagram where you need to show all the basic structures of the synovial joint. And what are those structures? So if you can see this diagram here, it's showing the basic structure, which is a bone. Here on top and down there's a bone, and the synovium, there's synovial fluid, there's cartilage, there's capsule, there's tendon, and of course there are some ligaments. So this is a basic structure which we expect to see when you are asked to draw a well-labeled diagram of the synovial joint. From there, B2, they are asking us to mention 3 drugs and their dose and 3 side effects of each that may be used in treatment of Mr. Chinyanta. Now, on drugs, we have so many groups of drugs which are used, but for now, we'll start with corticosteroids. So corticosteroids, we have a lot. These are medications that reduce inflammation, pain, and they slow joint damage. So we'll pick one example of corticosteroids, which is prednisolone. Now, prednisolone, remember they're asking for the dose and the side effects. So prednisolone, the dose is 5 milligrams daily, okay, which you can be given in temporary doses, 2 out of 2 months, at least for 2 consecutive months in a year. So when you see 2 over 12, they are saying 2 months just out of 12, okay. Then for side effects, we are saying there's Cushing syndrome, there's immunosuppression, thinning of bones, cataract, weight gains, and diabetes. So this is an example on corticosteroids. You can pick any other corticosteroids, but remember the side effects. Then the other group of drugs, it's non-steroidal anti-inflammatory drugs or NSAIDs. These drugs will be there to relieve pain and reduce inflammation. Now, what are these drugs? These are drugs which are sold on counter, and NSAID, good examples of such drugs, there's ibuprofen, there's indocin, and there's aspirin. So here we'll pick one example, which is aspirin or ASA. Now, this example of aspirin, the dose is 600 milligrams TID per oral, and the side effects is GIT disorders, abdominal pains, indigestion, nausea, and vomiting. So this is the second drug you can light on. If you are not comfortable with aspirin, you can use ibuprofen or indocin or any other NSAIDs, non-steroidal anti-inflammatory drugs. the third group of drugs which you can pick on are DMARDs. So these DMARDs are disease-modifying anti-rheumatic drugs. Okay, now these are drugs which simply slow the progression of rheumatoid arthritis and they save the joint and other tissues from permanent damages. Okay, now here we have a lot. We have a common example, it's methotrexate, okay, which we have taken note and which we want to discuss on. So let's look at this methotrexate. So this one, the dose is 7.5 milligrams to 25 milligrams per week. Now, so the lowest dose you can give is 7.5 milligrams, okay, in that particular week. And we are saying the highest dose we can go for is 25 milligrams in terms of managing rheumatoid arthritis. So side effects, they vary, but includes things like fatigue, headaches, drowsiness, liver damage, bone marrow suppression, and severe lung infections. Then the other class of drugs we can discuss are immunosuppressants. So these are drugs or medications that simply act to tame the immune system, which is out of control in rheumatoid arthritis. So in rheumatoid arthritis, we are saying the system, it is out of control. So immunosuppressants will try and tame this immune system. Now, on immunosuppressants, we have a lot of examples and we are going to focus on azoprine. So these are medications which increase susceptibility to infections. They will put you at risk of developing infections. Now, this drug azathioprine, okay, the dose, it is simply 1 to 2 milligrams per kg, which can be given IV or per oral, single daily dose. And the side effects includes irritation of the stomach, nausea and vomiting, fatigue, sore mouth, ulcers, even blood in urine, and stool. The other drug we can discuss is chloroquine. Now, chloroquine also can be given in management of rheumatoid arthritis. So the dose you can go for is 400 milligrams daily for 3 months. And then the maintenance dose can be done using 200 milligrams daily. For side effects, includes the retinal macular degeneration, blindness, even if large doses are used. So blindness, retinal macular degeneration comes in if we lose it at large doses. So the other question which they asked us is to identify 5 problems that Mr. Chinyanta will present with, and while on traction, manage them according using the nursing care plan. So here the common problems we can face is pain, which can be related to musculoskeletal disorders, and anxiety related to health status and traction devices, and also knowledge deficit, which can be related to treatment regime, and even the traction devices. Then impaired mobility, which is physical, which can be related to musculoskeletal disorder and traction, and also risk of infections, which can be related to traction. Remember, it's skin traction, so risk of infection. Then self-care deficit, the patient will be failing to manage him or herself, especially when it comes to feeding, bathing, or other hygiene-related practices. So apart from that, we have been also asked to identify 5 nursing topics we would include in your IEC on discharge. So in topics, you can talk about adherence to treatment, which is very important, taking drugs and how and when to take them. It's very important that you give them that knowledge the patient should know. Then on reduction of morning joint stiffness. So patients should have a warm bath on rising at bedtime to reduce the period of morning stiffness. Apart from that, they should avoid stress on joints. Patients should avoid putting stress under the joints. Then from there, importance of diet, there you can stress that it is important for the patient to take balanced diet. And apart from that, you can also talk about prevention of muscle wasting. It's very important of doing exercise which are passive in nature to prevent muscle wasting. Then you can also talk about recognitions of signs of drug toxicity. So teach the patient on possible side effects of drugs and how also to recognize them. Then also explain on the nature of the disease. Remember, there's levels of anxiety. So here explain the nature of rheumatoid arthritis for patients to understand that is a chronic disease and may require major changes in lifestyle. Then also explain the procedures which has been done. So explain all diagnostic tests, procedures, for example, x-rays which has been done and other investigations. Okay. So the other things you should consider is rest and sleep. Remember, because of anxiety levels, you need to encourage the patient to rest by spacing the daily activities and have adequate sleep to correct sleeping postures. The patient should also sleep on firm mattress, which is very advised, and avoid pressing pillows under the knees, which encourage friction deformities. Apart from that, you can also talk about intervening to patient sexual concerns. Now, on this one, discuss the patient's sexual concerns. So for now, this is where we end. We've revised our question. So in case of any question, you can subscribe to my YouTube channels and you will enjoy all what comes with it. Thank you very much.